Herd immunity. We heard some this week. Some of the major newspapers were reporting that an advisor to the Trump administration is an advocate of herd immunity and a quote herd immunity approach to the pandemic. So what is a herd immunity approach to the pandemic is basically saying, you know what, all these measures that we're doing, let's just stop doing them. We don't need to flatten the curve anymore. We don't need to control transmission. We're just going to let everybody get it, and then we'll try to protect the vulnerable people at that time, and we'll let the amount of immunity in the population go up, and then the COVID can't transmit anymore. And that's how we're going to get out of this. I think the kindest way to comment on that approach is to call it controversial, because there are definitely pluses and minuses to just allowing a virus to run rampant through a population so that immunity can be acquired by people. There have been examples of epidemics in the past where herd immunity was acquired. Obviously, the 1917-18 pandemic flu eventually was pushed down because of herd immunity. There was no vaccine in those days. There was no really any other way to do it. But there were, millions of deaths across the world from that. Medieval plague was extinguished because of herd immunity, and I don't think anyone would advocate that approach for plague right now, if that should occur again. And so the thing about herd immunity is, first of all, you have to be reasonably assured that the immunity to a virus is going to be long-lasting and profound. Do we know that for COVID? Well, there does seem to be immunity, I think, even in population-based studies. How long it lasts, we don't know yet, because it's not been around long enough to know. And there are areas in our country that have developed perhaps enough immunity in their population where you could think that their population might be partially protected to having another wave or another surge come through, such as New York City, parts of Chicago, so on and so forth. That immunity there tends to be very focal, so it tends to be even neighborhood specific, borough specific as far as it goes with New York. And so there are parts and pockets of that population there that would still be very susceptible. How much of a population needs to be immune to really push things down? Somewhere between 20 and 80%. How's that for a nice range? So I guess if you want to pick it in the middle, it would be what, 40%, somewhere in there. But it's not all or none. The more immunity you get in the population, the more help you get. And so if you think about it, how we protect ourselves, or how we can protect our communities from COVID transmission, what do we do now? Well, we personally distance, we wear masks, we avoid large gatherings. So if you think of those each as a discrete thing, 1, 2, 3, mask, all right, gatherings and distancing, and then you add on some immunity, it's going to help. So as time goes on, there will be some help from it. What would happen though if we just completely said, let's just forget about it? We're going to have a couple bad 2 or 3 months. We'll all get sick, but that's okay because we'll get through it. But we'll protect our vulnerable people. All right, well, let's go through that. Well, so first of all, protecting our vulnerable people, how are you going to do that? Well, I guess if you look at nursing homes and really make them a true island and a true bubble on your own, you might be able to protect them. You're going to have to deal with staff members and people who take care of people in nursing homes who are getting sick. And if you don't allow them to come to work, are you going to have enough staff to take care of those people? Because the virus will be running wild through a population, a lot of people getting sick at one time. So let's extend that a little bit. Probably 70 to 80% of our vulnerable people in the United States aren't in nursing homes. They're in their own homes, or they're living with a family and other people. Or you could even have a 40-year-old who's working part of the workforce, and they have diabetes and heart disease. And so they're a vulnerable person. How are you going to protect them? So you can't just build a bubble around every vulnerable person in the United States. It's just not possible unless you want to herd them all up and put them in a camp on by themselves. And that's just not acceptable, obviously. So protecting vulnerable people, while it might sound good, is really not possible. The third thing is that if we have a lot of virus going through a community at a very, very high level and a lot of people getting sick, it's going to shut everything down. We're going to be like we were when we were in shelter in place, but we're going to be in that spot not because we're trying to keep from getting sick, it's because there are so many people who are sick. So if you have so many people who are sick and they can't work, how are you going to keep your grocery stores open, your hospitals open, your fire stations open, your police active, so on and so forth? And this actually was the problem during the 1917-18 Spanish flu pandemic, that where the experiment with herd immunity, because there was no other way to really for them to do it, and social distancing wasn't well worked out then, that it really got in the way of critical services. So it's just not a tenable support. So if we really wanted to do herd immunity, you got another option, and that would be to vaccinate once we get a good vaccine. And I think that's preferable rather than having communities that are just totally devastated by sick people, and probably somewhere around 2 million deaths, which if you think about that number of deaths, that means every family will be touched by COVID in a very, very bad way, one way or another. And if you think about the extended family. And I think most of us in public health would say that that's just not acceptable. So you'll be hearing more about the herd immunity approach. There's really only one country who's tried it with the COVID pandemic, and that was Sweden, and it didn't work well for them, and they ended up walking back on that approach. And by the way, Sweden has 100% coverage for health care for every one of their citizens, which we don't have here in the United States. If we vaccine then, if